So the three T's is something that I discuss quite a lot with my clients. I discuss this in our health talks. I discuss this on report findings. We talk about this in the history, but essentially there are three. We've covered one, which is thoughts. And what we're going to do is we're going to cover one that most people typically think of when they come to a chiropractor, and that is trauma. So trauma essentially isn't just having accidents or falling. Trauma can include anything from sitting with bad posture for long periods of time. It can be falling. It can be falling down the stairs. It can be sports injuries. Some people will even feel trauma when they bend over to put their socks on. And realistically, the bending over to put your socks on that made your back go, in reality, wasn't ever the thing that made your back go. It just so happened to be the straw that broke the camel's back. So there are things that we can do physically. All right, so when we talk about trauma, we're talking about physical dysfunctions. There are things that we can do that will physically traumatize our body, and there are things that we can do that physically reverse the effects of trauma. So some of the things that we might look at that increase levels of trauma in the body: bad posture, being sedentary, falls, sports injuries. All right, and again, the list can go on and on and on and on. Sitting for work. We've got loads. This list could go on and on and on and on and on and on and on. But essentially what we basically know is that these things are going to increase deformations in tissues, whether that's neurological tissue, whether that's muscular tissue, whether that's skeletal tissue. It starts to deform and affect those things, and not necessarily in a positive way. Now, ironically, we've got exactly the opposite. We've got things that can decrease the levels of physical trauma. Simple things such as stretching. Stretching can actually really help improve stuff like bad posture. So can strengthening. So doing exercises, okay, and again, this can start to reverse some of the effects of maybe being sedentary. We can do increased levels of exercise, whether that's CV, resistance, whatever. Joints are designed to move, and that movement in the joints starts to help lubricate and actually improve the actual function. We can do things such as work on our posture so that we can reduce the biomechanical load. So what we know is if the balance of this and this are in equilibrium, then we shouldn't be causing any physical trauma onto the body. However, if one of these is higher than the other, essentially what's going to start to happen, if this one is higher than this one, what we're going to start to see is actually distress or injury start to take place. And that's when we start to see the effects of disease, whether that's, like I say, repetitive strain injuries, lower back pain, headache, neck pain. These all come from states of physical trauma that create an imbalance in our body. And over time, we then start to see deteriorations in that person's health, whether physically, chemically, or emotionally. Hope you enjoyed.